In a shocking incident in January, 18-year-old University of Victoria student Sidney McIntyre-Starko died from a drug overdose in a dorm full of people but did not survive. In an open letter to Premier David Eby, Sidney's parents say how her daughter would still be alive if 911 call takers, campus security, and the university had acted with the urgency needed to save her. On May 7th, the government of BC announced that they would be exempting public spaces from the state's decriminalization policy effective immediately. This bans the use of drugs in public spaces, including inside hospitals, on transit, and in parks. Because of this recriminalization, police now have the power to prosecute and remove people from the area, seize drugs, or make an arrest. This move comes almost a year after BC first announced their 3-year plan to decriminalize illicit drugs including heroin, cocaine, and fentanyl. Why did the state decide to take a step back? Let's take a look at some statistics. After the state decided to start safe supply of these drugs in the year 2020. As we can see, from just 2019 to 2020, the number of deaths caused by drug toxicity increased from 987 to 1,173 and has remained pretty constant since then. The average number of deaths per day increased from 2.7 to 4.8 and has remained at a constant rate of 6.3 since then. This means almost 7 people in BC die every day due to drugs. 79% of these deaths are male and 70% of them are aged only 30 to 59. This drug policy is the failed drug experiment of the BC New Democratic Party, and Premier David Eby continues to maintain that while substance addiction is not a criminal issue and shouldn't be treated as such, and he wishes to reduce stigma around it, it cannot come at the cost of public security. Nurses in the province have recently been very vocal and raised concerns over their safety as drug use in hospitals continue to worsen. A leaked memo from the Northern Health Region showed how nurses are prohibited to seize patients' drugs and weapons. This is especially concerning for nurses who are breastfeeding or pregnant as they are being exposed to toxic fumes. There have been reports of nurses who have had to stop breastfeeding their child due to exposure to meth smoke. In 2023, BC Emergency Health Service paramedics responded to a total of 42,176 overdose patients, which is an average of 116 calls a day. This is a 25% increase from 2023. 44% of businesses say crime and public safety is one of the main issues they're dealing with. What are your thoughts on the decriminalization pilot program? Does it seem to be working, or does the state need to get rid of it as a whole? Be sure to tell us in the comments below.